Three things happen during an asthma attack. Number one, inflammation of the airway. So those tissues actually start to get inflamed, making the hole that the air has to travel through a whole lot smaller. The smooth muscles around the airway also contract, so that again makes that airway smaller. And the third and final thing that happens is we get excess mucus production, which fills whatever is left of the space. So what does asthma look like? Difficulty breathing. This person might start to turn blue around the lips or fingertips. This is called cyanosis, and this is telling us that they are not getting enough oxygen. Not only do asthmatic patients struggle to get air in, they also really struggle to get it out. They can get this gas trapping, causing a bit of a barrel-shaped chest. You're going to hear a wheeze potentially, and the reason you're hearing that wheeze is because the air is trying to push past a smaller space. If I ask you to whistle, the first thing that you do is purse your lips and force the air through that smaller hole. And that's essentially what's happening in your airway. If at any point you hear your asthmatic patient with a wheeze progress to a silent chest, there is absolutely no airflow happening there. And that's a really big red flag. How many words they speak in a sentence is actually a really reliable indicator as to how much they're struggling. When we have a person speaking full-blown sentences with 20 words at a time, just like I am now, you can tell I've got really good airflow. But by the time I'm speaking in 4 or 5 word sentences, that airflow is definitely limited. I can't breathe. Can you please help? So by the time I'm speaking 1 to 2 word sentences, breathe, puff up, this person could potentially become unconscious. When a patient is struggling to breathe, the position that they prefer to sit in is what we call a tripod position. They like to sit forward, bracing themselves on their knees with their legs dangling beneath them. If you try and lie them down at this point, they will be too uncomfortable and will fight you to sit back up again. The reason that sitting in this tripod position works for them is because it helps with the internal organs dropping down into that pelvic girdle, which creates some space for those lungs to expand. So this is more comfortable for them as they feel they're getting a little bit more oxygen in. A really good way to identify how bad this situation could get is to ask a few yes or no questions that they don't need to vocalize for, so just some of this. One of the questions that I personally ask is, have you been admitted into an ICU department with your asthma before? Have you been intubated, a tube put down your throat because of your asthma before? And if they indicate yes, then there's every chance that they could absolutely get to that stage again, which means you should be prepared for this patient to potentially go unconscious. If they don't have an asthma management plan, we will be referring to the standard 4x4x4 technique. So what is the 4x4x4 technique? 4 puffs, 4 breaths between each one, and wait for 4 minutes for it to take effect. We're going to pop this one into the patient's mouth, create a really good seal around the mouthpiece, and encourage them to take nice big beautiful breaths in and out of this spacer. Now, they are going to be struggling to breathe, so just encourage them to do as best they possibly can, and we can at least deliver some medication into those lungs. So I'm going to release 1, so 1, 2, 3, 4 breaths. Second puff, 1, 2, 3, 4 breaths. Third puff, 1, 2, 3, 4 breaths. And fourth puff, 1, 2, 3, 4 breaths. Wait for 4 minutes. If it's not working, if the patient is not improving, if they are deteriorating, then we are going to keep repeating this process over and over again as often as we have to until the paramedics arrive to take over. And you're probably thinking, well, what happens if I overdose the patient and give them too much of this drug? This is a relatively safe drug in that if you do give too much or if you misdiagnose, then it's not going to have life-threatening potential, which is why it's one of 3 medications that our first aiders can actually carry and administer in the workplace. The other 2 medications would be your EpiPen or Anapen for your anaphylaxis management, or an aspirin for chest pain. So 3 medications, and this is one of them. If they've had too much of this salbutamol puffer, the first thing that the patient will notice is their heart will start to beat quite quickly in their chest. They might feel those palpitations. The other thing is going to be a bit of a tremor that they develop in their hand. And you've got to encourage them to continue taking this medication, because this is not their asthma getting worse, it is a side effect of this medication being administered. Once we stop, you'll find that those side effects tend to subside. If at any point during your management your patient suddenly loses consciousness and they are no longer breathing, you will commence your CPR 30 to 2 as soon as you can. When you are delivering those breaths during CPR on an asthmatic patient, you will probably feel resistance in the airway. So when you're blowing into that mouth, you probably won't get much air through that inflamed airway. So just be prepared for that. But absolutely do continue trying to get some of that oxygen in, because this is the patient that really needs it.